Episode 2, The Fatty Liver Epidemic in India. Welcome back to The Silent Killers. I am Dr. Chaitanya, an internal medicine specialist from Hyderabad. And today, we're diving into a condition that's quietly becoming one of the biggest health threats in India, fatty liver disease. When most people think of liver problems, they imagine alcohol as the main cause. But did you know that non-alcoholic fatty liver disease, known as NAFLD, now affects almost 1 of 3 Indians, many of whom who don't drink at all? Fatty liver is exactly what it sounds like, excess fat in your liver cells. And while it may seem harmless, over time it can lead to inflammation, scarring, liver failure and liver cancer. Why is this happening now? The answer lies in our changing lifestyle. Our diets have become rich in sugar, rich in refined carbs and processed oils, and our lives sedentary. Combine that with stress, less sleep and rising obesity and you have the perfect storm. Even children in Indian cities are being diagnosed with fatty liver disease. That's how serious this epidemic is becoming. But here's the challenge. The liver is a silent organ. It won't show symptoms until significant damage is done. But early on, you might notice fatigue, brain fog, discomfort in the right upper abdomen, slightly elevated liver enzymes, which can be identified on your liver function test. You don't need a biopsy to detect it. A simple ultrasound or a fibroscan can catch fatty liver early. If you're overweight, diabetic, have PCOS, high triglyceride level, it's worth getting checked. Early detection is key. The good news. Fatty liver is completely reversible in the early stages with the nice and good lifestyle changes. No expensive treatment is required, no fancy pills, just simple, consistent action. Here are my 5 steps I give to my patients. Eliminate added sugar, no soft drinks, no sweets, no packaged foods. Switch from refined sugars to whole grains, millets, brown rice and oats are good for you. Eat healthy fats, nuts, seeds, avocados, ghee and cold pressed oil. Move daily, walk 30 minutes or add resistance training at least 3 times a week. Deep sleep is when your liver detoxifies. So deep sleep helps. So a real story from my clinic. Sunita, actually I'm a friend of mine, 40-year-old homemaker from Jubilee, complained of acidity and constant tiredness. Ultrasound showed fatty liver. No medications were required, just food changes, evening walk and good sleep hygiene so the liver can detoxify itself. In 3 months, her liver profile improved, actually became normal. So the final message from this episode, your liver can regenerate only if you create the right environment for it. Let's stop the epidemic before it reaches deeper into our families. Protect our children and protect the future generations. If you found this episode helpful, share it with someone you care about, especially those who struggle with belly fat, tiredness and elevated blood sugar. I am Dr. Chaitanya and this is The Silent Killers. See you in the next episode.